Patients with balance problems often complain about their vision, particularly blurring, jumpy vision, or dizziness when moving or in busy environments, such as a shopping mall. The ability to keep vision stable when moving is complex. It requires the accurate function of multiple sensory and motor systems in the body. The systems required for stable vision or gaze stability include the visual system. More specifically, the ability of the eye muscles to move effectively and the ability to see clearly. There is clinical interest in not only the ability to see when still, such as measured in an eye exam, but also the ability to see when moving. The proprioceptive system of the trunk and neck is responsible for maintaining head orientation relative to body position. The vestibular system is the balance component of the inner ear. More specifically, gaze stability is the function of the Vestibulo-Ocular Reflex, or VOR. The function of the VOR is to stabilize vision when viewing objects or words while moving, particularly at higher head velocities. During normal head movements, the eyes rotate in the opposite direction of the head at the same speed. This stabilizes the image on the retina so that it can be seen clearly. When the VOR is impaired, vision becomes blurry with head movement. This can often be associated with dizziness or instability in busy visual environments. Evaluation of VOR is an important part of the examination of dizziness and balance problems, and it can be the most challenging. Vision at lower speeds is stabilized by more central brain functions, such as the smooth pursuit or saccadic visual systems. However, the VOR is essential for stabilizing vision during higher velocity head movements. Therefore, the challenges are first to isolate VOR from the other visual systems, then to evaluate how well it is working, and finally, to understand how it is contributing to the balance problem. Neurocom International, the leader in clinical balance assessment for over 20 years, offers protocols designed to evaluate VOR function. The inVision system contains 3 protocols that offer new precision to evaluate this important function. The perception test is a baseline measurement taken to ensure the patient can perceive the stimuli within the time allotted in the vision test protocols. The gaze stabilization test measures how fast a patient can move their head without a loss of visual accuracy or acuity. The dynamic visual acuity test measures how much a patient's ability to see clearly declines while the head is moving. Normal individuals experience very little decrease in visual acuity when their heads are moving during activities of daily living. During testing, multiple variables are simultaneously monitored by the inVision system computer. It is this control that makes the accuracy of these protocols possible. Head velocity and position are continuously measured by the sensor worn on the patient's head, allowing the operator to monitor the speed of head movement. Only when the head velocity meets selected VOR criterion levels will the visual stimulus be presented. The stimulus appears and the patient indicates the direction of the optotype E. The computer records and evaluates patient response patterns for the selected movement directions, either left-right or up-down. The computer randomizes the presentation of the optotype so that the patient cannot predict which direction or repetition of head movement will trigger the stimulus. Based upon the patient's responses, the computer determines when enough information has been obtained to conclude the test and report results. How is this information of VOR function used? When a VOR impairment is identified and its effect on vision and balance determined, the information supplements site of lesion findings to help in clarifying equivocal diagnostic tests. The information is also used to set specific activities for rehabilitation and provide an objective benchmark for monitoring patient progress through the treatment process. As an example, individuals can typically see clearly when moving at velocities of 120 degrees per second. If a patient can only see clearly to speeds of 40 degrees per second in one direction, then the VOR exercises are customized to that velocity range and direction. Introducing the right exercise at the right time is critical to recovery. With its precise control of multiple variables and its ease of use, inVision makes the complex simple. These unique results contribute to our understanding of the visual components of a patient's balance problem. It is the best available tool of its kind.